so sad to talk about Alzheimer's, but Alzheimer's is becoming so prevalent, particularly among seniors, and that's some sad situations. We deal with a lot of it at home instead, and I think it's important for families to know, particularly when your loved one it has the initial stages of Alzheimer's. Some things to try to do. One is to try to recognize that their actual brain cells are dying, and the mass in their brain is actually dying away. The brain actually weighs less once they progress with Alzheimer's, but it's not altogether the same person that they may have known their entire lives. And so they do things and say things that become frustrating. And so I want to encourage families just to recognize that that's not intentional. It's due to something physical, and they can't help it. Last week I was in a home where of an older couple, and the gentleman has got the early stages of Alzheimer's, and I bet while I was sitting there talking to him that at least 12 to 15 times he said, "Did you realize I went to college at this certain college?" And every time I said, "No, I didn't realize that. Tell me about it." And so he would talk a little bit about it, and then his wife and I would talk a little while, and then all of a sudden he'd just interrupt again and say, "Hey, did I tell you I went to college?" And I would say, "No, tell me about it." He has no idea that he was repeating himself. He has no clue that that's what he was saying. And so if you open it up to an argument then and say, "Well, you already told me that," well, they don't know that. So my recommendation is for somebody that repeats themselves a lot is just to go along with it. For people that have, maybe it's called disruptive behavior due to Alzheimer's, there's some techniques called redirecting, by bringing their attention to something else. And people will often say, "Well, if you ask me to redirect, or if you ask me to lie to mom, then I'm lying to her." Well, for instance, if mom says, I've got to go see my mom, is she outside? Well, her mom may have passed away 50 years ago. But you can say something like, "She was outside, but she's gone, she's coming back." I don't really see that as lying, because what you're doing is you're dealing with the disease, and you're helping calm that individual, and you're helping them to deal with the disease as well. So just remember, their brain is not the same, and if you'll be patient and be kind and be sweet, you will avoid a lot of problems and a lot of arguments down the road.